Hi, I'm Dr. Valiant See, OB-GYN practicing, specializing in infectious disease in reproductive system. And today I'll be answering the most asked question on the internet about women's health. So let's dive in. First question from Pixel Panda. At what age are we supposed to start seeing a gynecologist, or in particular an OB-GYN? Actually, first of all, if you want to be seen by an OB-GYN at the first, usually you're pregnant. Malamang, pag buntis ka, that's the first doctor. Now, you're not yet pregnant, having your first period, not exactly need to check for a gynecologist. But if you're curious enough na hindi ka regular datnan, might as well check it. But most of the time, if you had your first menstrual period, we call it menarche, it's usually irregular. That's normal. The first 2 years, most. Beyond 2 years, irregular pa rin, might as well see a gynecologist. Or, when we will start, if there's any problem down there, bakate, may lumalabas, may masakit, might as well see an OB-GYN gynecologist. Okay, next question. From Lazy Wanderer, my period is irregular, should I be concerned? So, this is somehow related, but now, let's assume na regular siya, tas not irregular. Okay? It should be concerned, especially if you want to get pregnant. Because there's a dictum that if you're regularly menstruating monthly, tendency mo, you can get pregnant in mid-July. Pag irregular ka, there's a hormonal imbalance theoretically that might make you a problem in getting pregnant. So you need to check it. Common condition is like polycystic ovarian syndrome, but not that only. Polycystic ovarian syndrome is actually on the sugar metabolism. Pag masyado kung maraming asukal sa katawan, it can affect the ovarian function. But there are other entities like stress, pinaka-common, or sometimes thyroid disorder, or sometimes may iniiba ka lang sakit, infection. Infection down there, or even systemic infection. I have seen patient na may tuberculosis sa baga, hindi siya magka-regla na mabuti. It's probably from there also. So have a check-up, wag ka mag-assume. Mga iba papunta ng Quiapo, inom lang ng shock tong, hindi totoo yun. Okay? Next. From Sophia Indasan, is it harmful for teenagers to take painkillers for period cramps? The answer is no, because that's the first line. Okay? You take it precautiously and take it as prescribed by the doctor. Painkillers are not that harmful, but they are serious if ginawa mong candy every minute, every second of the day. And also, you take it on an empty stomach. But might as well see an OB-GYN because not all period cramps are normal. Baka mamaya you have other problems pala causing your cramps. Taking painkillers is just to alleviate your symptom. Di yan gagaling. Okay? Next question, are menstrual cups safe? Pwede ba to sa virgin? From Naps on Naps. Menstrual cups is actually safe. It's your option. It is similar to a napkin. Yun lang ang cup. You need to put it inside para saluhin yung mga blood. Okay? Now for virgin, obviously pag virgin, maliit pa yung opening. There's a sizes na maliit naman na pwede mong ipasok. Yun. Next from Kinda Kylie at 29. Do virgins need pap smear? Pap smear is actually not for virgin but not for all female of reproductive age or sexually active. But most of the time, we ask them to have their pap smear 21 years old and above, okay, irregardless of sexual activity. Why the pap smear is for screening of cancer of the cervix. Cancer can happen to virgin, non-virgin, any one of the people of sexually active kay hindi. Yun. So that's the main purpose. We need to screen it, okay? Now, Starry Night told your question, can you get pregnant with polycystic ovarian syndrome? Of course. Yun lang nga, pwedeng mahirap. As I told you earlier, it's a hormonal imbalance. You need to balance it before you get pregnant. But there's a chance. Especially nowadays with the high technology, pag talagang hindi kayang natural method, you can refer to a reproductive medicine specialist. Pwede ka nilang in vitro fertilization. But still, it's a long process. You need to hormonal imbalance. Next is Kapediaris, 77, Tagalog to. Ano po may isa-suggest nyong PCOS food, lalo na for breakfast and snack? Wala. Okay? They ask the dietitian for proper, pero dapat dyan proper diet. Limit na sugar, saktong carbo, protein, and fat. Kung you're polycystic at matakaw ka na, medyo bawasan mo. And usually, it's more exercise also. Wag extra rice. Okay? Next, what do you think of a super cheap Inositol online? Inositol is actually a supplement for polycystic ovarian syndrome. You can take it. Kung super cheap, hindi ko na sigurado. Baka mamaya, ano lang yun? Asukal lang yun o kaya harina, hindi mo sure. So get it from the prescribed doctor, get it from the legit drugstore, okay? It's a question from Petunia LUVR. Okay? Next question from No Break Kit Kat. Any advice for PCOS aside from diet and taking pills? Almost the same. So management of PCOS talaga, first line even if you read our medical book, lifestyle modification, diet, exercise. The pills and taking some hormonal is just to supplement para habang hindi pa nako-correct yung metabolic imbalance mo, nagme-menstruate ka or nag-regulate yung hormone sa katawan mo. Other than that, kasi pag hindi, you're high risk for developing cancer in the future or you'll develop the male hormone factor, the androgenism. Okay? Next, kay G180, is it really bad to have a baby past 35? Actually, it's not bad. Kung nabuntis ka after 35, swerte mo. But there's a theoretical risk now that there's the abnormality in the baby as one go age. But actually, that's 1 in a million. But probably even it's 40 plus and above lang siguro. Pero ang bad dun is 35 and above, every year, you increase 1 chance of getting pregnant. Okay? Compare mo dun sa below 35 o below 30, if they want to get pregnant, tendency mabilis, assuming there's no hormonal imbalance. Pero mag 35 and above, yung ovarian reserve ninyo, yearly bumabawas pag hindi ka pa namukuntis. So chances of getting pregnant above 35 is possible low, but not all. I have some colleagues na 40 na nagkakaanak pa eh. I even had a chismis heard from other hospital. A senior consultant, kala niya menopause siya. Nagpa-pregnancy test sa buntis na pa na siya. Near 50s na siya, near 48. Hindi siya makapaniwala kasi magkakaapo na siya, may anak pa siya. It happens. Okay? Next. Coffee for preggy, decaf ba? From barely away to 1 to actually coffee is not contraindicated in pregnant. You just take a certain amount, may guide lang kami. But if you're really a coffee drinker, sometimes I do allow them. Just to share you, I have one patient in the past. She's near delivery, kaso nagka-problem, inadmit ko, binedress ko. Sabi ko, wag ka muna kumain. Kasi nga baka manganak siya. 24 hours, hindi naman siya nanganak, pero nag-complain siya na hang sakit ng ulo. Akala ko na emergency ako, ba't sumakit ang ulo niya? Nung na-rule out ko, nakita ko, sabi niya, hindi doon siya nakapagkape na 24 hours. O sabi ko, nung uminom siya, nawala lahat ng sakit na kino-complain niya. So may taong gano'n. Adik-adik sa coffee, you cannot stop them, even they're pregnant. Siguro probably pag pregnant ka, conscious ka, you might as well decrease taking it. Pero kasi kung masyadong marami, actually wala naman masama. Pero sometimes lang siguro, there's theoretical na kasi coffee can cause you palpitate. Pag pregnant, physiological magpapalpitate. Baka malito ka, di mo rin po abnormal ba yan or coffee-related lang. Monique Lucine, how can I help my wife through postpartum depression? Postpartum depression is actually, rarely tayo makadiagnose ng ganyan unless it's fully depression, you need to refer to a psychiatrist. Pero most of the time, the postpartum depression rin nakita niya, parang lang yan. Hindi siya na-shock. Nabagod lang siya after ng mga anak. Imagine mo, laki ng tiyan niya na ilabas niya. Iba siguro yung feeling na they undergo the entire labor process. Tapos paglabas, parang lang sila. Walang ganang kalagaan ng bata after din ng mga anak. That's actually part of it. Bagay niya support. Kausapin mo na, tabihan mo. Pag hindi kaya alagaan, kayo muna. But syempre, not forever. Sabihin mo rin na mag-move ko, di ka. Pero most of the time, postpartum depression for me is parang napagod ka. Okay? Does taking oral contraceptive pills have a long-term effect, especially in terms of fertility? Bayan na ito sa mga alipanti. Okay? Oral contraceptive pills has no long-term bad effect actually. If you take it as prescribed, it's actually protective from cancer in the breast, in the uterus, and in the ovary. In terms of fertility, it won't affect. Okay? Baka tinatanong ka dito, pag naka-pills ka palagi, obviously hindi ka mabubuntis pag naka-pills ka palagi. You need to stop your pills to get pregnant. Long-term bad effect, very rare. Very rare. There's some side effect na immediate. When you notice it, consult agad your OB or immediately stop it and consult the doctor. Yung common side effect na naman niya, which sometimes notorious, it can cause blood clot, it can cause varicosities. Yung mga yun, you need to stop it talaga. But most of the time, it happen on a high-risk female. Pero if an ordinary, average, healthy female na nagtipills, less risk mo yan. Can stress really have a huge impact on conceiving? The answer is yes. Macdoco, it's yes. Okay? Sometimes in infertility, when we do workup, na-roll up na lahat, hindi hormonal, walang barado, okay yung sperm ng lalaki, wala rin problema ibang babae, sometimes it's really stress. You ask them to rest and distress, namubuntis rin sila. Actually, stress is a factor in everything. The next, so specialty to, how do I know if it's yeast infection or just a normal discharge? By Viper VAR1. Normal female discharge usually aram ng babae. Kung kailan siya nagkakaroon ng hindi na discharge. Okay? Usually, it's non-foul smelling. If ever may amoy kulob lang yan. Now, if it's foul smelling or many in amount, usually kasi they found normal physiological discharge before menses or after menses. O kaya in between, may paisa-isa, probably madumi lang, di malinis. Pero magtuloy-tuloy, it might be abnormal. Lalo na may amoy. Common amoy na notorious, amoy isda. Amoy isda, ano amoy isda? Punta ka palengke, malayo pala na amoy mo, amoy isda, yung baba mo. If it's yeast infection, wala kamoy yan. Pero it's whitish discharge na super kate. Makating, hindi mo makakalimutan. Is getting an HPV vaccine important? From Galactic Penguin 42. Okay. May mga follow-up questions sa isa-isahin ko. HPV is human papilloma virus. That's the virus that is seen in the body of the human being anywhere. But in particular, there's certain strain, 16, 18, 6 and 11, pero in particular, 16 and 18, that can cause cervical CA or cervical cancer. Okay? The vaccine is for prevention of that cancer. Okay? Yes, it is important because cervical cancer nowadays is increasing, not yet being controlled despite vaccine, especially the Philippines setup. I see cervical cancer patient even post-menopausal na-infect sila ng HPV that progress to cancer. And cervical cancer actually is curable, pero paminsan mahirap. But most of our patients came in late that is already incurable and they ultimately succumb to it. Okay? But giving the vaccine, not 100% guarantee you, but I think more than 90% can protect you from developing that infection. And of course, preventing that infection would not progress to cervical cancer. What's the difference between an STI and STD? Spelling. Rosibune. STI, sexually transmitted infection. Baka yung infection na kinakausap mo. STD, sexually transmitted disease. When you say disease, it's abroad. May sakit. Anong klaseng sakit? Infection. So they are the same. When you say sexually transmitted, paano mo nakuha? It is transmitted through sexual contact. You cannot have that if you do not have sexual contact. Hindi na nakukuha sa hinatsingan, inupuan sa CR, sumutang panty ng iba. It should be sexual contact. May penetration, wala. It should be sexual contact. Okay? How often do we need to do STD testing? No. Ito. Ano kaya sagot ko rito? From Baguio Cactus 50 depends. Okay? Honestly speaking, if you're a commercial sex worker, yun. You need to do it quarterly or monthly. O naman na monthly o weekly, no? Yun. But if you're regular, ordinary people, but claim to be sexually active, yung mga nakikipag, ano bang term yun? FUBU, unofficially yours din sa tabi-tabi. How often? Pwede rin monthly or every 3 months. Actually, in guideline in US, CDC, you need to check it every 3 months. Pero for here, Sandra, yung suggestion is try to avoid that unsafe sex para hindi mo kailangan magpa-STD screening. Now, if it's unavoidable, you do it monthly or when the symptom comes. Okay? Is it possible to get an STD if your partner doesn't have any? Ayan. Haway ang habot mo dyan. Existential crisis. If you have STD, pero yung partner mo wala at never nagkaroon, umamin ka. Baka meron ka ibang partner. Yun. Or, depends on the STD. For example, some STD like acute one, yung chlamydia, gonorrhea, usually immediate contact yan. After 2 to 3 weeks or months, magkakaroon ka. But some STD may be long playing like hepatitis B or HIV. Pwede you contract it long time ago, ngayon lang sila nag-develop ng symptom. So if your present partner wala, pero may partner ka dati, ayun, i-track mo, umahanap. Pero impossible yun, yung partner mo, first timer, ikaw rin first timer, ikaw rin na kaya hindi sa wala, ay, that's a question. Next is, how are condoms only 98% effective? I think this 90% effective is preventing of STI. In terms of preventing getting pregnant, I think it's not 100%, pero most of the time, it's near 100%. Wag lang nabutasan. That's an emergency case. Remember when I was a resident, hating gabi, gigisingin kami, may couple sa ER, nahihiya magpakonsulta. Diretso sa amin, nabutasan ng condom, humihingi ko anong gagawin. Yun. Usually we give them our emergency pill. Now for your 90%, 80% effective, it's from SCI. Especially for HIV, because on studies, the tiny pores in the condom, mas maliit pa ang HIV virus doon. So they can pass through. Okay? In terms of getting pregnant, it's near 100. Wag lang mabutasan. Oh, you didn't wear it the right way. Baka naman nilagay mo after the ejaculation. Ay, wala na yun. Okay? Mature, effective ba ang calendar method? There's no natural method that is 100%. But usually, this is effective, especially if you're regularly menstruating. At tama ang bilang mo. Kami kasi mali bilang mo din yun. Tapos may mga time, minsan pag-stress ka, o kaya whatsoever thing, nag-lapse yung menses mo, mali na bilang mo, mauulit yan. Okay? Next is thoughts on pull-out withdrawal method. That's okay. I think it's effective. Yun lang kailangan humabol ka na withdraw mo bago mahuli. Pag nahuli, ayaw ka na naman. Okay? Psychological matters, it happen, pero usually if you're a couple, nag-uusap kayo, and you agree not to want to get pregnant, you need to do that method, I think there's no problem with it. Can you take a bath on a period? Gusto ko naman itong tanong ni Digital Normal, kapanahon na pa ng lola ko. Pwede. Kasi dati may kasabihan pag nagregla ka, mabuang ka pag naligo ka. Siguro pag buha ka, baka nangyari sa'yo yun. Try mo, wag mong gawin. Okay? Now, couch potato chips, what are the chances of actually getting STD from sitting on a public toilet? I think this is a common question. I thought when I was a resident and even a student, this is one of our choices sa exam. Kala ko it's only a tricky question. Yung pa namin na do actual practice, talagang nagtatanong sa akin. Kasi nag-CR ako sa public CR sa SM, madumi-dumi. Nakalimutan ko magdala ng pang-usaping. Hindi yan, ha? Pag nag-CR ka sa maduming CR, sa balat lang, sakit sa balat lang magkakaroon ka, STD. Ang galing naman ng bakterya, talaga nag-swim, papasok ng reproductive organ mo. Imposible yun. Kahit na mag-swimming ka, hindi yan rabasok dyan. Yun yung common na tanong pa. Di ba dati parang sa kapuso mo, Jessica, so nag-swimming siya, nabuntis na daw siya. O, hindi rin nangyayari yun. Okay? Try me at Fabo, is Antiperspirant deodorant giving cancer truly just an internet myth? There's no proven pa. Okay? Even in ovarian cancer in the past, sabi bawal bigyan ng pulbos ng bata, medyo matanda because it can cause cancer. Actually, cancer is cancer. Okay? But might as well, it's not proven. You can apply it in moderate amount na lang. Okay? Anastasia, what are the symptoms of HIV/AIDS in women? How do they differ in men? Okay, let's start. HIV and AIDS actually is a different thing. HIV is the first phase of infection, human immunodeficiency virus infection. When you get infected, the virus is in your inside, attacking your immune system. Pag wala kang immune system, all the different infection in the human body can develop. Okay? You have infection in the eye, infection in the heart, infection in the lung, pagtatae in the stomach, down the line. Okay? When your entire body kinain na ng HIV virus, you develop the AIDS, the acquired immunodeficiency syndrome. That is actually the last part of the AIDS. But if you're properly treated, you can revert back to the earlier stage. Hindi porket pag may AIDS ka, matitibok ka na. Okay? It is now curable but not treatable. Okay? How do they differ in male and female? The same. You develop both the symptom. Okay? Usually yan, the symptom, if really symptomatic, unexplained fever. Lagnat na lagnat na hindi mo malaman, wala nang cause. Some patient I think is na-diagnose with tuberculosis. Although tuberculosis is very common in the Philippines, in other countries, ang TB, it's already eradicated. Pag nagka-TB ka sa ibang bansa, ibig sabihin your immune system is too low para mahawaan ka. So they would test you for HIV. Nowadays in the Philippines, because of the predominance of TB, hindi ginagawa yan long time ago. But nowadays, because of HIV increasing, they don't test TB patient with HIV. Half of them get positive with HIV rin. Pero ang symptoms lang yan, ubo, lagnat, na TB lang. Other symptoms, especially in my pregnant HIV, they are pregnant normally. Wala sila iba nararamdaman. Incidental finding upon testing because HIV is a routine test in all pregnant, nagpa-positive. Those are lucky person na we can treat them while they are not symptomatic. But some HIV pregnant I saw came in, napaka-taasan ng lagnat, anemic, may pneumonia ang ayang gumaling that even the general OB-GYN hindi na nila magamot. That's the time they referred to us when we were corrupt ay HIV ka na pala. Yun. Okay? Some symptoms of HIV, meron unexplained skin disease. Yung mga may balakubak dyan, o kaya may mga seborrheic dermatitis, yung namamalat na sakit.
sometimes it's a sign of HIV, but not all those patients with HIV naman in yun.
Is the number of cases still rising in the Philippines?
Yes, it's rising. Despite the COVID pandemic, tumataas yan. Hindi ko alam paano sila nakipag-meet and greet during pandemic despite of quarantine.
Mataas yan. Okay? What people do to avoid contraceptive? Practice safe sex.
Now, if you cannot practice, you do serial monitoring. Para you can, wag naman sa, serial monitoring kahit na ma-detect mo early, you develop it. Ang habol natin is to prevent, there's no vaccine for that. So, practice safe sex. Kung hindi imposible bago ka may pag-contact pa HIV, test mo muna yung partner mo para mas masaya. Pero imposible yun.